good morning. I'm Dr. Artie Majan with one of my patients who is here at Deuk Spine Institute, and your back pain is cured, right?
Yep.
Do you still have the back pain from before surgery?
No.
Alright, is it gone?
Yeah. All I have is the surgery pain, not
Yeah.
the back pain I had previously.
Do you have the sciatica shooting down your left leg that you had before surgery?
No, thank goodness.
Okay. So she underwent a fusion surgery yesterday with decompression, and if you watched the surgery, you saw how much pressure there was on the nerves during the surgery, and we took all that thickened ligament and bone. You had a lot of bone hypertrophy, your facet joints were huge, your spine was twisting, by the way, with scoliosis. And we corrected that deformity. We put in screws and rods. We tested all the screws and rods to make sure they weren't pushing on any nerves. And the surgery really went perfect. You had 25 milliliters of blood loss for an L4-5, L5-S1 transforaminal lumbar interbody fusion open with osteotomies, bilateral to correct deformity, and pedicle screws, rods, interbody cages. So you had the surgery done outpatient, right?
Yes, sir.
You went home a couple hours after your surgery.
Yes, sir.
No hospital stay. And how are you feeling today?
But better than what I thought from what everybody else that I've spoken to who's had surgeries in the past. I wasn't expecting to be able to get up. I expected to be crying all the time.
Well, you're right. That's because elsewhere, this type of surgery, you'd be in severe pain for about a week on a
That's what
morphine
everyone
pump.
told me.
Yeah, but not here. We do things different at Deuk Spine Institute, better. And that's why we broadcast everything, so other surgeons can learn from what we do. So the back pain's gone that you had for how long did you have this back pain?
Year and a half.
Year and a half. And you can tell, right? Because
Oh, yeah.
normally you would be able to tell if that pain was still there.
Definitely.
And it's gone.
Mm-hmm.
And you're recovering at home.
Yes, sir.
And how does it feel to be able to go home and recover the same day of surgery rather than be in a hospital?
Weird. It feels weird because I've had surgeries before and I've been in the hospital. This is great. I get to go home to my bed
Right?
with my family, and it's a lot easier on a patient, I think.
Outpatient spine surgery, when it can be done safely, is better because you get to go home and you don't have all those patients in the hospital that are sick, right? That
The infection.
the infection rate's higher when you do surgery at the hospital. And there's no COVID here at our facility, so you get to have a COVID-free environment, whereas the hospital has COVID patients, so filling up the hospital.
Yep.
So yeah, outpatient spine surgery at Deuk Spine Institute, pain-free, less than 24 hours after her surgery, at home. Went home the same day as surgery, being taken care of by her lovely husband over here. And anything else you want to say to the people around the world watching?
If you don't want to suffer, you need to get it done, because I feel better than what I did. And that's all I cared about, was getting the pain away. I had no quality of life, none. We went from fishing 4 days a week, hiking, camping, to nothing. And I want to fish badly, so.
What kind of fishing do you do?
Saltwater, freshwater, trout fishing in the mountains.
All right. Well, I would expect some good fish to be on my dinner table one of these days. Compliments of you guys for
There you
fixing your
go.
bag. Yeah, that's why we do what we do. We don't do surgery for any other reason than to give people the quality of life back to them that chronic back pain or neck pain has stolen from them because they can't do things. So I'm happy for you guys. Just, take care, and we'll see you in a week to get
Yeah.
your staples out.
How many staples?
You have about 25 staples. This is a big
Goodness.
incision. Yeah, this is a fusion surgery, so her incision's about that big. You have a lot of staples. All right? Thank you.
Thank
Thanks
you
for
very
doing
much.
that. Appreciate
Thanks.
it.